Hello everyone, I'm Dr. Rakshay Shetty. I am a pediatric intensivist and I head the Department of Pediatric Intensive Care and Emergency Services at Rainbow Children's Hospital, Marathahalli in Bengaluru. What I thought today was I'll talk about some basic life support tips, and this is especially important for young parents. As you might observe, when the child starts walking at around 1.5 years of age, the child tries to explore environment, and during that whole process he tries to explore his physical limitations, and during that process sometimes the children do pose themselves to dangers. They pose themselves to choking hazards, they pose themselves to physical falls, and sometimes even falling onto water and creating trouble for themselves. So in this video what I thought is we'll go through certain steps what you might have to do if a child poses himself or herself to a choking hazard. So I'm going to demonstrate this by a video. So choking, as you know, when a child tries to eat something, it might block the breathing tube, and that can actually cause breathing difficulties and make the child blue, and if it is not treated on time, it might be a life-threatening thing. So the way to go about managing a child who has choked depends upon the age of the child too. So let's imagine it's an infant, a small baby. So what you would do in that particular case is lift the child on your hand so that child rests comfortably on your arm, chin is supported, and you can from the base of your hand give 5 thumbs, okay, and then slowly turn the child back, see if the foreign body has come out to the mouth. If not, you would give compressions again 5 times and then see if the body has come back. If you are unable to find a foreign body in the mouth, you would repeat this step at least 3 times, and if you are unable to get the foreign body out, you need to see the doctor immediately. Of course, when you start this process, it's important that you identify someone who can go and call the doctor or an ambulance if needed. Whereas if it's a bigger child, the process is slightly different. So if it's a big child, what you would do is you stand behind the child and make a fist, keep it below the ribs, that is somewhere in the upper part of the abdomen, and then give a 5 big thumbs. So this again can be repeated 3 times. So with that, majority of the time you will be able to actually save a life by this very simple technique. In this video, I'm going to share certain tips about how would you respond to someone who's unresponsive, and my focus would be predominantly on children. So let's imagine you find a child unresponsive. The first step would be, if you know the name of the child, call the child by name, either by tapping or by tapping the foot or the shoulder. If child is unresponsive, look if the child is breathing or not. And second thing, if you are unable to find that the child is breathing or not, or if the child is not breathing well, just has been gasping breaths, then look for the pulse. So in young babies, we look at the pulse at the axilla. Okay? So if you are unable to feel the pulse, that means the child's both heart as well as breathing, it is not functioning. So you need to get some help. So either go and rush to call some help, or you ask someone to call an ambulance for help. Meanwhile, what you would do is you would start chest compressions. Now, how to do chest compressions? In small babies, you would enroll the chest, keep your thumbs encircling just below the nipple, and then give compressions. So you would start compressions, give around 30. How deep to press? Now that is roughly around 1/3 of the anterior-posterior diameter. So it should be roughly around 1.5 centimeters deep. It is really important to press deeply, effectively, at least at the rate of 100 to 120 per minute. Now remember one thing, the quality of compressions, how deep, how fast you press, that is the one thing which is going to save life. If you are alone, you can give 30 compressions and you can give around 2 breaths after 30 compressions. If you are 2 people, it can be 15 compressions to 2 breaths. The technique slightly would differ if it's an adult patient, because you wouldn't be a bigger child or adult, you wouldn't be able to encircle the hand around the chest. So in that case, okay, so when it comes to a bigger child or an adult, the technique is slightly different, but the approach is exactly the same. So you would see if the patient is unresponsive, is he breathing or not, can I feel the pulse or not. In bigger child and adults, you would look for the neck pulse. Alright, so if you don't feel a pulse, patient is not breathing, it is an emergency. Every second you are going to spend, that's going to decide the fate of that particular child or a patient. So you would call for a help, meanwhile you would start chest compressions. Again, you would identify a place in center of the chest at around nipple area, and then you would keep your hand in this fashion and you would generate movement from your shoulders. Remember, this movement has to happen from the shoulders, not from elbow, not from wrist joint. So it has to be from your shoulders. Press deeply, relax. Again, this has to compress minimum around 2 centimeters deep into the chest. So good quality of compressions can save life. And remember the sequence. If you are alone, it is 30 compressions to 2 breaths. If you have 2 people who can resuscitate, it is 15 compressions to 2 rescue breaths. Now, of course, this is not a comprehensive video about how to go about basic life support. But in case if you're interested in learning more about basic life support, in case if you're passionate about saving lives, I would suggest that you attend one of the basic life support courses at Rainbow Children's Hospital, Marathahalli, every Thursday. The last Thursday of every month, we run basic life support courses. And in case if anyone of you are interested, please feel free to enroll. Thank you very much.